Hey everyone, I'm Dr.Supriya and in this video I am going to discuss all high yielding topic related to Pseudomonas. Okay, so that you can face any viva very confidently and can solve every MCQ based on related to Pseudomonas correctly. Okay, so let's discuss. At first, should describe Pseudomonas. Pseudomonas is gram-negative bacilli motile with a single flagellum and it is obligate aerobe and not fastidious. It should be your answer. Next question is, what is the virulence factor of Pseudomonas? Virulence factor include, answer should be, it include pili or fimbriae for colonization, toxins, uh, and alginate coat for biofilm formation, and polysaccharide capsule that prevented from phagocytosis. Next is mention the toxins of Pseudomonas. Then you should answer first. Pseudomonas produce non-diffusible toxin and diffusible toxin. Okay. Then next question will be name the non-diffusible toxin. Then non-diffusible toxin include toxin S, U, T and Y. Shut Y. Okay. And diffusible toxin include exotoxin A, elastase, protease, phospholipase, hemolysin and pyocyanine. Next question is, among these toxins, what is the most virulent toxin? Then answer should be exotoxin A. Exotoxin A is most virulent toxin of Pseudomonas. Next is, what is the mechanism of action of exotoxin A? Then answer should be, it acts by ADP ribosylation of elongation factor 2 that leads to inhibition of protein synthesis. Next is, can you answer which other bacterial toxin the mechanism of has same mechanism of action as exotoxin A? Then your answer should be, it is diphtheria toxin. Diphtheria toxin act in a similar way, that is ADP ribosylation of elongation factor 2. This is. Next is, mention the pigments produced by Pseudomonas. Pseudomonas produce 4 types of pigments, that is pyocyanine that impart blue-green color and it is produced by Pseudomonas aeruginosa only. And next is pyoverdine, it is also named as fluorescein and it impart greenish yellow color and it is produced by all species of Pseudomonas. Next is pyorubine, it impart red color, and last is pyomelanin that impart black color to the Pseudomonas colony. What infections Pseudomonas can cause? Answer should be, Pseudomonas can cause skin and soft tissue infection that include infection to burn wound, ichthyoma granulosum in AIDS patient or patient having neutropenia, toe wave infection, green nail syndrome and Pseudomonas dermatitis in individuals using spa or swimming pool. Next is It may cause ear infection in children's, termed as swimmer's ear, and in elderly, it is termed as malignant otitis externa. It can cause corneal ulcer in contact lens user. It can cause ventilation associated pneumonia and chronic respiratory tract infection. Next question is, Pseudomonas can cause mild febrile illness. What term is used for that? Answer should be Shanghai fever. Next question is, Shanghai fever resemble what other kind of fever? Answer should be typhoid fever. Shanghai fever resemble typhoid fever. Next question can be, what other infection Pseudomonas can cause? Your answer should be, Pseudomonas can cause cellulitis with characteristic blue-green pus, osteomyelitis or septic arthritis, meningitis in case of post-operative patient or traumatic patient, and UTI in catheterized patient. Confirm or diagnose that this particular patient have pseudomonal infection. Then your answer should be, we will grow or culture the specimen of patient, and we assess the colony characteristic. It should be oval, round, oval, opaque with metallic sheen and bluish green color of colony due to presence of diffusible pigment pyocyanine or pyoverdine. Okay, this is the finding on nutrient agar, and on blood agar we will see beta hemolytic colony. On McConkey agar, these are non-fermenter, so non-fermenting pale color colony. And on oxidase test it is positive, catalase test it is positive for catalase test, and it is not going to ferment any sugar. Name the selective media of Pseudomonas. Answer should be cetramide agar. And next question can be, pigment production can be enhanced by using which media? Your answer should be King's media. King's media can enhance pigment production in Pseudomonas. For treatment of pseudomonal infection, we can use among penicillin, piperacillin, meslocillin, ticarcillin, among cephalosporin, cefurazone, cefepime, polymyxin B, colistin. These are the drugs that we can use for pseudomonal treatment. And next question can be, why hospital acquired infection or ventilation associated pneumonia is commonly caused by Pseudomonas? While we maintain hygiene, cleanliness in hospital, even after that, why Pseudomonas is the most common organism to cause hospital acquired infection? For this question, your answer should be, Pseudomonas are resistant to most of the antibiotic as well as resistant to most of the disinfectant. Just because of this, Pseudomonas cause hospital acquired infection most commonly among all other bacteria.